safe for a typical person to go to a health food store and purchase, but which are still very safe and very effective nutrients. So very least that will be in our scope. In British Columbia, naturopathic doctors prescribe antibiotics and hormones and a lot of other things, and that hopefully will come. And you know, in Canada, there may be only 1,600 naturopathic doctors. There aren't very many of us. Over half of those are in the GTA, and maybe only 8 of us now in Kingston. We're becoming a bigger profession here. So it takes some political pull to improve the legislative backup for who we are and what we do. And I see some other incredible professions that just don't have that pull yet, but they'll get there.
So does that mean that if this was something that you resonated with an individual, that they could choose through OHIP to have a naturopathic doctor instead of a regular doctor?
That would be wonderful, but no, a lot of it is health insurance benefits right now. Because we've been licensed for so long, or at least naturopaths have been licensed for so long, a lot of people have health insurance benefits that cover it, at least to a certain point. Queen's not so great compared to the governments or the bigger institutions in town, but you know, in BC, the provincial government did cover naturopathic doctors for some time, but the problem is that because we're trying to look at the whole picture, put all the symptoms together, find the underlying cause, and that takes a long time. Our first appointments are an hour to 2 hours. And a physician, their medicine is entirely different. You're in and out in 5 minutes, ideally. Paying a naturopathic doctor a lot more money for their time compared to a medical doctor caused you know, it was complicated, yeah. And so eventually the health insurance plans took away their funding for naturopathic medicine because now the provincial government covered it, and naturopaths were reducing their time with patients to almost nothing at all. So it really ended up decreasing access to medicine by having provincial government coverage. So I'm not sure where we need to go with that. That's it would be great to say let's have OHIP cover it. I hear that a lot. Only 5 days ago or so, finally the federal budget came out, and we're now HST exempt practitioners. That's helpful to start, but we've still got some ways to go. I don't know if it comes with helping insurance companies see just how much money they're going to save really if they start covering people for all these other forms of health care, and what real prevention can do. So just a quick list of who requests the services of a naturopathic doctor, and a lot of it is people who fall through the cracks. You know, people who are tired, stressed out, or sick all the time. It's a whole system in their body that's out of whack, and the symptoms are so generalized, and they could match so many potential labels that mainstream medicine doesn't really know what to do with it. It's the advent of chronic disease. Mental health, hormonal stuff, women's medicine, that's becoming a lot more well-developed in the last 10 years, but our inheritance is a patriarchal system, and men classically were the subjects that were studied in research, and so a lot of our protocols are based on men's physiology, not women's physiology. Health prevention, ideally, where the environment comes into play as well, the understanding that we're a part of our environment. Alright. Okay, so let's start the good part of this, which is about thinking about your experience with primary care, mainstream medicine. And does anybody care to share a little bit about why they go to their family doctor, what happens when they go to their family doctor, what hasn't happened?
Family doctors are good for things that fit inside the boxes that they see. And if you're an atypical presenter or have something rare or unusual, they just say, well, then it doesn't exist. Because we haven't seen you on that one day that thing happened, or we weren't at the ER when you were in there the last time. So yeah, if you're at all unusual, they just throw their hands up and say you must be crazy. So it fits a lot of people.
I was about to say, I mean, everybody's unique, so I mean, it can be so quickly that
they want to
fall
just say,
out of
here's an
whatever
antibiotic, go
is
home
like.
and you'll get better, right? It doesn't work that way. Yeah, for people with rare things.
I have to say that, I mean, I go to still a family physician because it's covered, right? Because it's, you know, in some respect that's the easy to go to kind of see if they can, you know, do whatever kind of thing that needs to be done. And I usually leave frustrated, but it's still in some respect. I mean, again, I mean, you're talking about health plans, well, you have to have a health plan before, you know, that kicks in, like, you know, that is a possibility. So that's one of the, you know, anyway, so that's one of the reasons why I go to mainstream medicine. Not so much because I'm convicted, I have convictions of what they do, and I think they're good at, you know, if I break my arm, you know, they're great at fixing these acute kind of things. I see them as mechanics, like good mechanics. They can deal with that, and so that's what I go to mainstream medicine for.
Yeah, it does play an important role in it. The system works well, and a physician doesn't know the answer, and they have a good relationship with their patient, then ideally they try to do some other kind of testing to find something. Mainstream medicine is based very much on objective evidence, or this idea of objective evidence, something on paper, and you often end up treating the paper, and problems occur when when there's an illness for which there isn't a lab test. Mental health is a big part of that, for example, where there are no tests to look at serotonin imbalance, for example, for depression, if that is in fact part of the problem. But if the system works well, they do some lab work. If they don't have the answer, they refer. That can work really well for some things, not for others. Yes, you were?
Yeah, somebody says, oh, because we don't pay for it. It's not true. We pay for it.
I'm not saying that we don't pay for it, but when I go, I don't have
Oh,
to
yeah,
pay,
that
and
time,
you know,
but
that makes a
when you
difference.
when you fill up your income tax, you pay for it.
Yeah.
That's right. OHIP means you pay for it with your income tax.
Yeah.
You don't pay when you go.
I know.
Point is
That's
that I
That's
do
what you
pay
were
with that
making the
in
point.
any
Oh,
case,
okay.
right?
Yeah.
But
Yeah.
if I go to my naturopath or an osteopath, then I have to pay in addition to,
Oh,
and
okay.
right then and there, and that comes out of my monthly income, and that can, you know, become very restrictive.
Okay.
But when you don't go to emergency, like I haven't for the last 3 years since I've seen a naturopath, I wish there was a box I could take off somewhere
Right?
saying,
Right?
"Please
I'm
say
not
yes,
using,
listen,
I'm
you
not
OHIP
using,
because somebody else
exactly.
figured out the problem that you couldn't, right?
Yeah.
So,
Yeah.
so
Yeah,
there's a way to balance in the quality of life where I say it's worth this much money
Yeah.
to be off skiing this past weekend with my kids, right? So.
Yeah, and how much money we end up saving overall individually, even as the years go by, and how much we value feeling well instead of
It'll work.
just
It'll draw it in, it'll work.
yeah. So I think in Canada it is a little bit more complicated, because how beautiful is it that we have OHIP and a government-funded healthcare system, but we are so separate from the actual cost of what medicine is. And there's a bigger philosophy here that causes more different problems than what they have in the United States. You know, that's where you see a lot of good research coming out actually for integrative medicine, is American research, and what labs they have to offer there for understanding our complete health is a lot more advanced than what you will find here, unfortunately.
It seems to me also in terms of research, you know, we hear more and more that the pharmaceutical company is being charged with the research responsibility for testing products that they've invested millions in developing. Like, it seems very wacko to me. It's highly unlikely that they're going to fund research into alternate healthcare practices. And if change is driven by empirical evidence, then that's a huge, huge barrier.
So that was part of the biggest difficulty of trying to put together this seminar, because politics for sure are a huge part of the difference between integrative medicine and mainstream medicine. Science and the concept of science, it's very cultural, it's very political. I could go on and on about that and this idea of empirical evidence or objective evidence, and how that does not apply to treating an individual as a whole person connected to their environment and all systems connected. It just doesn't work. But the philosophy of the different medicines is also quite incredible, and I think that's the key to making the political change, to understanding the limitations of science as something that's very real rather than so threatening to our mainstream. It works very well for some things, not for others. And so I'd really love to get a better understanding of the philosophical underpinnings of mainstream medicine, why we use it, how well it works and what it works well for, and where its deficiencies are. If we understand the deficiencies, those weaknesses, let's look at the other medicines to see where can we support that, and that's going to be, that understanding is going to be different for everybody.
And I think in some respect we will, I mean, my hope is, and conviction, that we will be moving towards that, just because the amount of money that we're spending on the traditional, healthcare.
Yeah.
It's sick management, really.